Korean public health law is enacted to ensure the quality of healthcare and to protect and promote the public health of the country, and it is closely related to our daily lives. In this video, we will discuss the legal systems of Korea related to medical services, drugs, and medical devices, as well as the specificity and challenges of each legal system. Medical personnel refers to a physician, a dentist, an oriental medical doctor, a midwife, or a nurse whose license is granted by the Minister of Health and Welfare. A medical institution refers to a place where medical personnel provides medical services or midwifery services to the general public or specific individuals. The Supreme Court defines medical practices as experience and functions based on medical expertise, such as the prevention of diseases or treatment procedures through diagnosis, post-mortem examination, prescribing medication and dosage, and surgical procedures, in addition to acts likely to cause harm to health and hygiene if medical personnel does not perform them. As national health insurance is mandatory in Korea, all citizens living in Korea are obligated to have the insurance. Private insurance systems that supplement the national health insurance are also available, covering the medical expenses for benefit as well as non-benefit items. The Health and Medical Governance Institution of Korea consists of the Ministry of Health and Welfare and the Ministry of Food and Drug Safety. According to the Pharmaceutical Affairs Act, drugs are classified into two categories: general drugs and prescription drugs. Due to the revised Pharmaceutical Affairs Act in 2000, the separation of prescribing and dispensing drugs was implemented, and out-of-hospital preparations for the outpatients of medical institutions became mandatory in Korea. It was institutionalized to promote the rights of the patients to know as prescriptions are disclosed. The life cycle of a drug is comprised of the R&D and approval stage, the manufacturing stage, and the use stage. In each stage, the safety, efficacy, and quality of the drugs are evaluated. In the post-marketing safety management of drugs, the risk levels are classified into 4 levels, and different measures are taken for different levels, such as the potential prohibition of distribution and sale, issuance of an emergency alert, and the ordering of a drug recall. Regulations on general drug advertising have continued to evolve throughout time. According to the Drug Advertising Guideline, names, manufacturing methods, efficacy, performance of drugs, etc. may not be falsely advertised or exaggerated, while the efficacy performance of drugs may be advertised by first obtaining a license or by submitting a report. A medical device is an instrument, machine, apparatus, material, software, or any similar product, alone or in combination, for human beings or animals used for the purpose of diagnosing, curing, alleviating, treating, or preventing a disease, or used for the purpose of diagnosing, curing, alleviating, or correcting an injury or impairment. Following the advancement of medical technologies, the new Health Technology Assessment (NHTA) system was introduced to promote the development and assessment of new technologies and devices. Medical devices are evaluated more quickly through a single window. Ensuring the safety of medical devices before marketing is focused on the reliability of the authorization and permission system, as well as the regulation of advertising for consumer protection. Safety management of medical devices and the development of evaluation technologies are important means of securing the safety of medical devices. The Minister of Food and Drug Safety may re-evaluate those medical devices which are deemed as requiring a re-examination of safety and efficacy for which the manufacturing permission or certification was obtained, or a manufacturing notification was filed, and order necessary measures according to the result of the re-evaluation. Only the product names mentioned in the certificate of approval or notification can be used for medical devices, while commonly used names may be used jointly. However, names that make people mistake them for industrial products cannot be used. Let us look deeper into the specificity and challenges of the Korean legal systems related to health and medical services. After the MERS crisis in 2015, Korea tried to improve the system on new infectious diseases. Korea has increased the amount of health and medical resources necessary for responding to infectious diseases, revamped the quarantine system, and unified the Disaster Response Control Tower. After the outbreak of COVID-19 in 2020, the Korea Disease Control and Prevention Agency was promoted to the Korea Disease Control and Prevention Agency to reinforce the disaster response system. On the other hand, Digital Signature Act was enacted in 2002, and the Electronic Medical Information (EMR) was quickly introduced, which as of 2017, 71% of medical institutions are using. It has led to quick standardization of information. As medical information is considered more important and sensitive than the general personal information, the protection of medical information has become an important social issue. Korean public health law has continued to evolve through different social and technological changes to provide quality medical benefits to the citizens. Legal systems that are related to public health and medical services are attached closely to the lives of each citizen, and therefore, roles of each system are important, and constant research and development are necessary for the advancement of medical services. Check out more videos on KLRI YouTube channel. Contact PR@klri.re.kr for inquiries.